So we will move on the next presenter. So the next presenter for this session is Dr. Sara. She is consultant. She will presenting her article on the topic of awareness level of improving immunity by lifestyle modification in doctors of Rawalpindi. Please, ma'am.
Assalamu alaikum. I'm Dr. Sara Tanveer and I will be discussing awareness levels of improving immunity by lifestyle modification in doctors of Rawalpindi. This study aims at assessing awareness levels of doctors about improving immunity by lifestyle modification. According to American College of Lifestyle Modifications, effective immune responses to infection can be developed by healthy eating, activity, good sleep, stress control, no smoking, and connectivity. Doctors need to be aware of it and practice it themselves so that they can advise the same to the patients and general population. The objective of the study is to assess the levels of awareness in doctors about use of lifestyle modifications to improve immunity. The methodology used was descriptive cross-sectional survey and it was carried out in Rawalpindi cantonment in August 2021. 100 respondents were selected through convenience sampling. Data was collected through questionnaires. The results were 90% of the doctors didn't take adequate hydration and balanced diet to improve their immunity. 60% of the doctors didn't do regular physical activity. 50% didn't take adequate sleep. And 30% of the doctors didn't know that stress damages immune system. These levels of awareness indicate that there is need to educate the healthcare providers about the benefits of lifestyle modification in creating the strong immune system which is necessary for doctors and general population. There is need of policy making for including lifestyle modifications as part of healthcare to bring a positive change in health of the doctors and general population. Thank you so much. If you have any questions, you may ask now.
Dr. Pakhanda. Thank you so much, ma'am, for sharing the knowledge with us. Really thanks, ma'am. Now it's time for our clinical gynecologist and obstetrician, Dr. Pakhanda, to present her article on the topic of role of lifestyle modification in PCOS.
Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Pakhanda Kamran, graduated from Fatma Jinnah Medical University, holistic coach, lifestyle medicine, consultant gynecologist, astrologist, certified psychiatrist. My today's topic is role of synchronized lifestyle modification in PCOS. My journey starts when I observed in my daily practice many teens with cycle problem. When I searched the reason behind it was irregular eating habits, sleep, and escape of breakfast. I joined Dr. Shubhika Firoz and learned how to reverse the chronic diseases by holistic lifestyle. Introduction: Polycystic ovaries. What is the polycystic ovaries? Polycystic ovary syndrome is a hormonal disorder common among women of reproductive age characterized by hirsutism, obesity, infertility, and oligoamenorrheas. According to World Health Organization, 8 to 12% of couples from the whole world are facing the serious problem of infertility. The percentage of infertility will increase in the coming future and will push the world towards the alarming situation. For the diagnosis of the PCOS, 3 criteria. Number 1, polycystic ovaries, by ultrasound, oligoamenorrhea, and evolution, clinical and biological evidence of hypergonadism. Situation in Pakistan: the prevalence of PCOS is higher among Pakistani women, 52%, than among Western population. UK is 20 to 20%, PCOS is associated with significant short and long-term health problems. These include many metabolic and cardiovascular complications, molded 2004, as well as the psychological disorders, depression, anxiety, sexual infection, social problems which affect the woman's identity and health-related qualities of life. The increasing high incidence of PCOS will be attributed to genetic factor, environmental factor considered as and PCOS has been strongly associated with future development of type 2 diabetes, glucose intolerance, hyperinsulinemia, cardiovascular disorder, and hypertension. Insulin resistance has been reported in 60% of patients with PCOS, including obese and non-obese population. To explore role of synchronized lifestyle modification plan in the management of the PCOS, what is the SLP? SLP is an objective of this is to explore the role of synchronized lifestyle modification plan in the management of PCOS. I studied in my outdoor patients, gynaecology for 3 years. Patients were the complaint of obesity, infertility, PCOS are selected through non-probability purpose sampling technique. A self-created form to check the routine of these women was used in the diagnostic form information related to the presenting complaints, wake-up time, weight, meal time, water intake, junk food intake, sleep, and physical activity included. Intervention, women who are not attempting to conceive, weight reduction, combination of PCOS, obesity, and progestin and metformin. Women who are attempting to conceive, reduction, clomiphene plus metformin. Symptom-specific treatment, hirsutism, OCPs, anti-androgens. Drug therapy, myostol, application of synchronized lifestyle modification plan, SLP. What is synchronized lifestyle modification plan, SLP? Dr. Shukta Firoz is founder of SLP. During the practice, she finds the link between the eating habits, sleep deprivation, and stress in the causation of chronic diseases and speedy aging. Over the years, she kept analyzing the relationship between the individual components of the lifestyle and their impacts on various human systems, which lead to birth of synchronized lifestyle modification. SLP. SLP is a fully developed lifestyle modification program with the 6 pillars we use. SLP 8 rules of correct eating, nocturnal sleep regulation, which lead to hormone production, melatonin, personalized physical activity, personalized stress management, management of various addictions, social connections. What is synchronized lifestyle modification plan? Physiological basis of SLP to attain homeostasis, to achieve iron control and pH balance, to align circadian rhythm with body clock. This is very necessary. Statistics analysis. The 154 patients, women were there, and the age of the percentage 11% are less than 20, 37% are 21 to 30, 22% are 31 to 40, and 4% are above 40 to 50. Weight in kg, 17% have 51 to 70, and 49% have 73 to 90, 19% have 91 to 110, and 5% have 111 to 130. A patient came to me with 129 kg, and within 2 months she reduced from with the SLP 115, and also she has PCOS, and She got married. She was 18 years age. Now wake
Respected
up
ma'am, I'm
time
sorry. I'm
28% to
interrupting your
6
session.
a.m.
Ma'am, time is
15%
over.
6 to 9 a.m. 16% 9 to 12 a.m. 1% have no response. Breakfast time. No breakfast in 21%. 42% are Vedanti. We have 30 minutes of the waking and 36% and after 1 to 2 hours and one have no response. Then the lunch timing, lunch 23% have no lunch and full meal have 63%, 5 have snacks.
Excuse me, Dr. Farhanda, madam. Madam,
7
can you please
to
come to the
9
conclusion?
p.m. have 54%, 41% and 9 to 11
Respected
p.m.
ma'am,
and
please come to
3%
the
have no
conclusion,
dinner
please ma'am.
and 2 have
Please
no
summarize
response.
it.
Now sleep time 11 to 12 p.m. 43%, 45% have 12 to 2 p.m. After 2
Respected
p.m.
ma'am,
7%, and
respected
9%
ma'am
have no
Farhanda, please
response.
conclude this.
Exercise 69% have no exercise and 31% have light exercise. Water intake in summers 84% have less than 8 glasses, 11% have prevent to reduce the onset of recreational substance. Thank you and take a message. Take your breakfast at time and sleep regulation is necessary for the SLP. Thank you very much.
Thank you so much, ma'am, for enlightening us. Really thanks, ma'am. Now the next presenter is Lieutenant Colonel retired Professor Dr. Masoud Goku. He is professor and the head of Department of Psychiatry at Islamic International Medical College. He will presenting online and sharing his views on the topic of food and mood. Sir, please kindly share your article.
Assalamu alaikum, everybody. Assalamu alaikum, everybody. Can you hear me, please? Assalamu alaikum, everybody. Can you hear me, please? Assalamu alaikum, everybody. So, Professor Masoud this side. I'm so sorry for connectivity issue. Can everybody hear me, please? Assalamu alaikum. Assalamu alaikum. Can you please hear me? Food and mood and compare eating pattern and
जिस तरह आपकी आवाज आ रही है आप जारी रखिए
and identify foods which improve mood and how to plan to reset mood with the food. So, food energy supply, that is the normal physiology. Missing breakfast can lead to low blood sugar and irritable mood. And if there is an adequate food, the way the current lifestyle is, it can also lead to low mood and cognitions. So there is a lot of mood disturbances in case the food is not taken appropriately in terms of time and in terms of quality. So this is the effect of mood. If we eat healthy mood, it definitely elevates the mood. If we don't take healthy food, if it is unhealthy food, which we are going to discuss shortly, it's going to lead to low mood or depressed mood. So as far as the relationship of the food and mood is concerned, the established relationship is vegetables, fruits, nuts, seeds, whole grain, plant-based food, legumes, low-fat, dairy, lean meat, and oily fish, for instance, are associated with reduction in mood swings, that is depression and angers, that contains sugary juices, drinks, and saturated fats, which is so common these days. So the nutrients in healthy diet help the brain to produce neurotransmitters like serotonin and improve mood and feeling of relaxation. Foods which stabilize mood and sugar level, such as whole grain, creates and prevents rapid sugar fluctuations and helps to stabilize the mood. Research shows that people in depressed mood, unless educated, are more likely to choose sugary, fatty, and salty foods rather than nutritious foods. If you allow me to skip and continue, clearly these relationships are complicated, but which is likely to be the stronger driver, mood or food? In other words, does the consumption of particular food lead to mood change, or is our mood generally the predominant factor in determining the food we choose to eat? There is a lot of research and both viewpoints, they are being supported. Generally, research suggests that foods we consume may be paramount importance, that of paramount importance, that what is eaten today may affect mood a couple of days or months later on. So consumption of excessive saturated fats, sodium was associated with worse mood 2 days later. While eating fruits, vegetables give a positive mood, and next day, effects was stronger for men, but mood was lifted in both men and women after they ate vegetables. What we can say with confidence is that eating a balanced diet confers not only physical health benefit but also better mental health and improved mood. Altering the type of bacteria, that is microbiome in gut, is the determining feature, and it may improve brain health. Omega-3 fatty acids, fermented foods, probiotics, and other polyphenol-rich foods may improve your gut health, gut-brain axis, and ultimately the mood. Research shows interesting and complex relationship of food with the mood. In this picture, you can see the current culture of food intake by the young people, which depressed mood. And on the right hand, you find the healthy choices, food choices, which can improve. If your blood draw, it feel tired and depressed. Avoid foods which make your blood sugar rise and fall rapidly, such as sweets and alcohol, which is so common in consumption. Eating food which may slowly release energy, like complex carbohydrates and proteins and fats, stabilizes the blood. To let me go, I would also like to share with you that getting enough protein important, as slowly digested and they maintain the glycemic index and overall energy production and useful neurotransmitters which help to maintain against the depressed mood. We have to break the vicious cycle trap, that is indulgence foods may boost energy initially, which is so common, and improve mood in the short term, but these positive effects are usually fleeting. For some people, such effects can often be followed by a drop in mood, guilt and depression. This can trigger more bad eating and set up a vicious cycle. Better ways of overcoming negative thoughts, including exercising, which has been shown to improve mood by reducing anxiety and stress, such as activities and such other activities not only enhances mood but also assists with controlling indulgence food intake. Research shows that are low in sugar, salt and fat, and focus on the long-term benefits of these healthy foods. People in a positive mood are more likely to choose healthy foods if they feel their good mood is going to last. If not, they may be more likely to choose indulgence foods to sustain positive feelings. So reset mood, consumption of excessive energy, saturated fats and sodium was associated with worse mood 2 days later, while eating fruits, vegetables gave a positive mood. The next day was stronger for men, but mood was lifted in both men and women after consumption of vegetables. Research shows interesting and complex relationships. What we can say that with confidence is that eating a balanced diet confers not only physical health benefit but also better mental health through improved mood state. Altering the type of bacteria in gut may be the mediating mechanism which improves your brain health overall. Omega-3 fatty acid, fermented foods, probiotics and other polyphenol-rich foods may improve your gut health, which may benefit the gut-brain axis. This is the marketing strategies which draws our young people towards the sugary
Respected sir, time is up. Please try to conclude this article. Please, sir.
Which are
Please, sir.
available every now and then in each and every market and shop. So take-home messages, food and mood have very intimate temporarily lift food and may temporarily lift mood, which is reinforced by very emotional marketing strategies and heavily paid TV and media ads and promotion videos. However, they may have long-term adverse effects on mood by direct and indirect means. Mood disorders like depression and related issues being a real global challenge with huge contribution to NCDs may be addressed at primary, secondary, and tertiary lifestyle medicine physicians to contain a burden of mood-related NCDs by
Sir, please try to conclude this. Sir,
providing
please.
to enjoy. With that, I thank you and wish you all the best. Thank you so much.
Thank you so much, sir. Really thanks, sir. Now the next presenter of the session is Dr. Aruj Arshad. She is senior lecturer at Rifa International University and presenting her article on the topic of quality of life determinants of obese individuals, a case control study. Please, ma'am.
I'm sorry for any inconvenience, but there is definitely some audio issue. For example, I can't.
Ma'am Fatma, are you here?
Good morning, everyone. I am Aruj Arshad, working as a senior lecturer in Rifa Institute of Clinical Professional Studies, Rifa International University, Lahore campus. Today, the topic of my presentation is Quality of Life Determinants of Obese Individuals, a case control study conducted by Aruj Arshad and Samia Khalid. First of all, let me elaborate about the abstract. So the present research was conducted to investigate the determinants of quality of life among obese individuals. It was hypothesized that attachment styles, including close, dependent, and anxious, negatively related with social support and the quality of life among obese individuals compared to the case control group. Furthermore, it was also hypothesized that social support likely mediates the relationship between attachment styles and quality of life domains that includes physical function, self-esteem, sexual life, public distress, and work dimensions of quality of life in obese individuals. For the study, cross-sectional sample of obese, 100 individuals, and the control 100 also matched on age and gender were taken from different universities using purposive sampling technique. And the findings from the Pearson product movement correlations highlighted that the attachment styles negatively predicted or related with social support in the quality of life of obese individuals compared to the moreover, the path analysis using MOS indicated that there is a significant partial mediating role of social support in study variables. That is, literature review. The most relevant question that arises here is why attachment styles are so important and how they do relate to the obesity epidemic. Attachment styles tend to proliferate from childhood to later years in life. So a sound body of research has demonstrated that secure attachment styles in comparison with others may have more positive influence in an individual's life. Moreover, insecure attachment styles tend to contribute towards behavioral and social problems more, as due to insecure attachment positions, eating might take the role of a distress regulation, as highlighted by Mahmoud and Al-Kamran in 2012 research. At this point, however, the rationale of the study is to investigate the factors that might help obese individuals to improve their quality of life despite lacking a secure attachment style that are formed in their early parent-child relationships. So what should be done to improve their quality of life? There might be some external factors such as social support that supports and buffers an individual against the possible detrimental influences of unhealthy attachment styles. In addition to societal factors, the pre-existing unhealthy attachment styles also give rise to a drastic combination unless some intervening factors such as social support balances their influence and serve as a protective booster of quality of life. Hence, in the present research, the researchers explored factors like social support that might help obese patients to have a better quality of life, even when they have insecure attachment patterns in their early relationships. So the study was designed with the following objectives. The basic objective is to find out the mediating role of social support in the relationship between attachment styles that has been developed earlier in the life of individual and the quality of life among the obese participants. So hypotheses were the relationship between attachment styles, close dependent on issues, social support and quality of life determinants would be different among obese and controlled individuals. And secondly, social support is likely to mediate the relationship between attachment styles and quality of life in obese individuals. For the present study, a cross-sectional between group research design was employed, and the sample was of 200 participants, which were equally divided into two groups. One of the groups was of obese individuals, and the other was of control, matched on age, gender, and socioeconomic status. And the sample was recruited from the following universities, from different universities of Lahore, including both the private and the public universities, with the following inclusion and exclusion criteria. That is, the sample was within the age of 18 to 40 years, with equal representation of both genders among both groups. For obese individuals, the screening was made on the basis of BMI, that is a body mass index, that should be greater than, for obese individual, it should be greater than or equal to 30, while for matched groups, the BMI should be less than 30. However, underweight individuals having a BMI less than 18 and individuals having any medical conditions commonly associated with obesity, like cancer, thyroid conditions, heart disease, type 2 diabetes, liver diseases, respiratory ailments, and reproductive issues were excluded. Following assessment measures were used, including the adult attachment scale for attachment styles, interpersonal support evaluation list for social support, and impact of weight on the quality of life for assessing the quality of life determinants to complete the questionnaire, and the overall response rate is 88%. For analysis, the following data analysis strategies were used, including the descriptive statistics, Pearson product movement correlation analysis, and structural and equational modeling using path analysis with the help of MOS. Here are some descriptives of both the groups, obese and control. Here are the mean and standard deviations of attachment styles of both the groups, and then the social support and quality of life determinants. As you can see that the attachment style, specifically close, is a mean of 1.96 in obese group compared to 4 in the control group participants. So overall, control group are depicting a close attachment pattern that is leading towards the secure attachment style compared to the obese individuals. That is the correlation matrix, which includes all the attachment style patterns, that includes close, dependent, and anxious, anxiety, and social support, which include appraisal, belonging, and tangible social support, and the compute of social support is also available in the correlation matrix. And last are the quality of life domains. And these results clearly highlighted that attachment styles are insecure in obese individuals, and that negatively predicted the quality of life, because they are negatively related with the quality of life of obese individuals compared to the case control groups, as the upper diagonal is reflecting the obese group correlations and lower diagonal is representing the control group correlations. There is the mediational model of social support, and the model is showing the excellent fit with the data, including the 3 independent variables, that is close, dependent, and Asians. These are the attachment styles, and ISEL is the social support compute, and dependent variable is quality of life, and these are the domains: physical, self-esteem, sexual, public, and work quality of life domain. These are the findings. As far as the direct effects of the path analysis are concerned, close attachment styles.
Your time is up, please.
The public quality of life and self-esteem
Respected ma'am, your time is up. Please conclude this.
While the entitled attachment
Session,
unique
please, ma'am.
contribution of individual inclusion. Previous studies have provided
Dr. Aruj,
evidence
please
for the
conclude
relationship
this.
between attachment styles, social support, and quality of life separately in obese individuals. However, this study exclusively studied the direct and indirect determinants of quality of life of obese individuals. Thank you so much for listening.
Indonesia.
Now the next presenter of the session is Professor of Physiology, Dr. Fatma Hassan. She will presenting her article on the topic of her article on the topic of comparing post-exercise cardiorespiratory components with BMI and physical activity status of young undergraduate students. Please, ma'am.
Thank you, Sana. Can you all hear me?
Yes, ma'am.
And is my screen being shared? Can you all see my screen?
Yes, sure.
Okay. Yes, ma'am.
Okay, so the topic of my study is to determine post-exercise cardiorespiratory components correlation with BMI and physical activity in undergraduate students. We all know that obesity and physical inactivity are linked to increased risk of cardiovascular disease, type 2 diabetes, some cancers, and all-cause mortality in a dose-response fashion. The more obese or physically inactive a person is, the higher the risk. To accurately address someone's future health risk, weight and physical activity should be considered and recommendations should be made accordingly. The current obesity rise in our youth is a great concern. With compromised physical activity levels, these are alarming and there is insufficient local data available. So the present study was conducted to compare pre and post-exercise intervention of the students with heart rate, breathing rate, blood pressure, and pulse oxygen saturation. Similarly, we also compared the BMI and exercise hours per week of the students with these post-exercise cardiorespiratory parameters. Now, this study was conducted at Islamic International Dental College. It was a cross-sectional study conducted from August till November 2021. Convenience sampling was used and was around 86 undergraduate students were recruited for the study. All the dental students between ages of 18 to 25 years were considered, and any student suffering from any chronic or acute disease was excluded out from this study. Students were made to fill an online questionnaire regarding their lifestyle along with a physical activity vital sign questionnaire, which is a tool created to quickly measure one's physical activity level by calculating minutes of physical activity per week. For ease of SPSS, we converted these minutes to hours. The physical activity readiness questionnaire, and if any positive score was, then that student was also excluded from entering into the intervention. After that, the students were instructed to pedal south 15 miles per hour. Both scale was used to assess the perceived exertion, and it was around 12 to 13, which is the moderate range. This board scale has a scale from 6 to 20, with 6 very mild and 20 the most highest vigorous activity. So when we made them to pedal that, their activity ranged in the moderate range. And we also reconfirmed it with the heart rate that fell into the 64 to 76% of maximum, which is again comes into the moderate range. Above the 77% comes into the vigorous activity heart range. So in the independent variable in our study was the BMI of the students and the exercise in hours per week. The dependent variables were these pre and post cardiorespiratory indices. BMI was categorized into as underweight, normal weight, overweight, and obese according to the WHO criteria, including the Asian cutoff values. Regarding the physical activity per week, we also categorized them into 4 parts. Number 1, those who were totally inactive. Then number 2, which were insufficiently active, that is less than 2.5 hours, which is the recommended guideline by the lifestyle medicine. Number 3 is the sufficiently active, falling in between 2.5 and above up till 4.4 hours per week, and beyond that, greater than 4.5 hours per week. So these were the 4 categories in which we divided the students. The descriptive analysis showed a mean age of 20, and with males 33% and female around 53%. And from the descriptive analysis, you can see the majority of the students fell into the normal weight category, and also in the a major chunk is also in the overweight category. Similarly, regarding the exercise hours per week, we had a substantial proportion in the who are inactive, but at the same time, we have the students which followed the recommended guidelines and over and above that as well. For the analysis of this data, we did the paired sample t-test to correlate the pre and post interventions. Then you can see that there was highly significant association between the heart rate, breathing rate, and pulse pressure pre and post. Whereas for the comparison of the BMI and physical activity hours per week, we did the Pearson correlation, and it showed only significant association with the BMI, whereas no significant association was found with the exercise hours per week. Within the BMI category, we found significant association with the heart rate and with the post pulse pressure level values. So to conclude my study, in our study, we found significant association of BMI with the post-intervention cardiorespiratory indices. However, we do need to further probe as BMI is not very accurate in assessing the obesity level. We can also add the waist circumference and the waist hip ratio into it to further correlate the these levels with the physical activity and correlate the sedentary lifestyle behavior. And where there were certain study limitations as well. Misclassification of the light, moderate, or vigorous physical activity brings an important limitations for this study, as over and under estimates of the physical activity may distort its association with health outcomes. And we would also like to include the maximum volume of oxygen the students exerted to be added for assessing the cardiorespiratory fitness next time, inshallah. Thank you very much, Jazakallah khair, for listening patiently. If you have any questions.
Thank you so much, ma'am Fatma, for sharing the knowledge with us. Really thanks, ma'am. Now our worthy MS call. Now the next presenter from Indonesia is Miss Nurani, will present on the topic of the medical student nutritional status during online learning. Please, ma'am. Ma'am, please share your screen, please, ma'am.
Yes, okay. Thank you, Dr. Sana. Can you hear me?
Yes, ma'am.
Okay. I will share my PowerPoint. Is it clear for you?
Yes, ma'am.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Dear colleagues, hopefully all of you are in the best condition. Thank you for the opportunity. I am Nuraini Junaid, part of Department of Nutrition, Faculty of Medicine, Universitas Islam Indonesia. Let me present our report, the medical students' nutritional status during online learning. It was conducted by me and my team, Niki Fajrahmawati, Zahra Rizkika Alia Safitri, and Siti Nur Hikmah Maulida Rinjani. I will divide my presentation into 4 sections, which are background and aims, methods, results, and conclusions. For the first are background and aims. We know that obesity is an established risk factor for mortality. 2.8 million deaths each year due to high body mass index. In Indonesia, the COVID-19 pandemic caused a crisis in March 2020. So we aim to assess students' nutritional status from the start of a crisis to after 6 months, then after a year. Then for methods, it was a cross-sectional study consisting of 100 first-year students. During a crisis, used online questionnaires at the Faculty of Medicine, Universitas Islam Indonesia. The inclusion criteria were similar and more than 18 years old and completed data taking. And the exclusion criteria were head eating disorders experience. All subjects received some procedures by Zoom meeting in December 2020 and June 2021. The 3 days food record was used to assess dietary intakes, and we analyzed them by NutriSurvey. The physical activity was WHO. All data were anonymized and ethical approval was granted by the Ethics Commission of FMUE. And data analysis was performed using SPSS software. And this is my results. This is about subjects' characteristic before eclasis, except nutrient intakes at 6 months after eclasis. The median age was 21 years old, and the BMI was 22.88 for males and 21.01 for females. Most subjects were in normal nutritional status. Based on Indonesian RDA3 was a little bit higher than the recommendation. But about the carbohydrate intakes were insufficient, but the lipid intakes were sufficient. And about the transition of subjects' nutritional status during online learning, our obese subjects were increased, which were 20% at the start of eclasis, became to 28% at the 6 months after eclasis, and higher at 1 year after eclasis, which was 31%. And until 6 months after online learning, our subjects were still in normal nutritional status, but after a year, they became overweight. And after a year of eclasis, the male subjects consume higher energy. It was almost double for protein adequacy and lipid adequacy, but their carbohydrate adequacy was still sufficient. Like male subjects, the female subjects had intake improvements after a year of eclasis. And about physical activity, most of the subjects did light physical activity. Their sedentary times were 9 hours per day, and there was no significant difference between 6 months of data and after a year data. So we conclude that online learning was increased students' intakes and worsened nutritional status, and we need to follow up on students' nutritional status a year later, moreover, if there will be offline learning later. So, thank you.
Thanks a lot, ma'am, for sharing the knowledge with us, for enlightening us. Really thanks, ma'am. Thank you, ma'am. Now, our worthy MS scholar, Ms. Farhat Shehzadi from Rifa International University, will be presenting on the topic of social media addiction, fatigue, and emotional well-being mediating role of circadian rhythm. Please, ma'am, share your screen, please.
Assalamu alaikum, this is me, Farhat Shehzadi, and my research topic is social media addiction, fatigue, and emotional well-being, mediating role of circadian rhythm. The study was supervised by Ms. Samia Khalid. She is lecturer at Refined Institute of Clinical and Professional Psychology, and she is also working as a lifestyle medicine coach in Pakistan. If we talk about lifestyle medicine and social media, you can see that lifestyle medicine focuses upon healthy lifestyle activities such as having whole food, plant-predominant eating patterns, regular physical activity, stress management, restorative sleep, and avoidance of risky substances, and positive social connections, whereas social media addiction can disturb our lifestyle. It can hinder our physical activities, or it can reduce our sleep or causes stress among users. In one study, it has been stated that blue light emitting from electronic devices arouses regions of the brain that make us feel alert or energizing us at a time when we should be shutting down. In one more study, it has been stated that time spent on internet, lack of bodily activity, and discount in napping hours can cause physical and mental fatigue, whereas Facebook use in one study have been associated with the lower level of happiness. According to Primac, those who use 7 to 11 social media apps can have, or platforms can have, developed signs and symptoms of anxiety and depression. In one study, it has been suggested that circadian rhythm have been associated with behavioral and physiological performance. Circadian disturbance may be environmental or molecular disturbance, both create negative and intense health outcomes. Social networking sites tightness may lead to irritability, procrastination, and irrational behaviors. In different studies, different studies have identified the negative effect of social media addiction, including depression, anxiety, emotional exhaustion, relationship management issues, and attention difficulties, sleep deprivation. In one study, Silver suggested that the fatigue and tiredness is harmful issue in daily life, and almost everyone goes through this state. But when a person is tired, he or she makes more faults, and they become confused or unfocused or unenthusiastic. Furthermore, it reduces efficiency in every field, and more significantly, the person having tiredness and fatigue may cause risky behavior such as having accidents. Our first objective was to explore that how social media addiction can disturb our sleep by disrupting our circadian rhythm. Second one was to have a better understanding of the effect of social media addiction on emotional well-being. And third one was about how to explore how social media addiction causes fatigue. And the final and fourth one was to investigate how circadian rhythm mediates the relationship between social media addiction and fatigue. In method, we have used correlational research design, and sampling technique was purposive sampling, and our sample size was consisted of 200, from which 49% were male and 51% were female university students. Those individuals who were using social media for entertainment purpose were included in the study, and individuals who were having mental health issues or having sleep disturbance were excluded from the study. If we talk about the effect of social media addiction on circadian rhythm, we can see that social media addiction has predicted 0.31 or 31% circadian rhythm, and social media addiction have predicted 0.091% emotional well-being among university students. As per about social media addiction and fatigue, we can see that social media addiction has predicted 0.11% fatigue among university students. And if we talk about the role of circadian rhythm as a mediator, we can see that the circadian rhythm have been found out to be a great mediator between social media addiction and fatigue. In present study, we have investigated the effect of social media addiction on emotional well-being and physical and mental health, as well as the functioning of circadian rhythm in the relationship. We also considered previous studies, and to our understanding, this is the first study that looked into the relationship between social media addiction, circadian rhythm, and fatigue among university students. After doing a thorough literature review and reviewing our findings, we came to conclude that the changes in circadian functioning can disturb our sleep, and disturbance in sleep can lead to fatigue and emotional problems among university students. The mediating role of circadian rhythm and how it plays a crucial part in maintaining physical and mental health is one of the most important findings of this study. And this study added to our understanding of the dangers of excessive use of social media. If we talk about the limitations of study, One of the major limitation of the study was lack of generalizability because we have chosen a specific sample, a student sample, so we cannot generalize the study to other samples or population. Furthermore, correlations between several scales were average and such as pain, scale of positive and negative effect were having low Cronbach alpha reliability. If we talk about implications, those who utilize social media more frequently than usual will benefit from this study. We'll come to know how they can keep themselves healthy, or they can keep themselves safe from dangers of using excessive social media use. Those that start health-related programs such as lifestyle medicine, experts can look into these findings, or they can develop treatment plans by considering the importance of lifestyle activities. People should understand how crucial good circadian functioning is for healthy life. This research has paved the way for future studies.
Thank you so much, ma'am, for sharing the knowledge with us. Really thanks, ma'am. Now, the last presenter of the session is Ms. Urva Rizvi. She is the research assistant at Rifa International University. She will be presenting her article on the topic of smartphone addiction, quality of sleep, happiness among young adults. Please, ma'am, share your screen, please, ma'am.
Assalamualaikum. Can you hear me?
Yes, ma'am, we hear you.
Okay, that's great. So, the topic of my presentation is smartphone addiction, quality of sleep, and happiness among young adults. So, the abstract of my presentation is that, well, most of the things that we do in our lives nowadays is by using a smartphone, whether it be for socialization or gaming or even groceries. So smartphone addiction has disturbed various parameters of our life, so it needs to be tapped, and it has a great connection with our sleep routines. So sleep has been proven to be the major pillar of the lifestyle medication and how it caters the individual's overall well-being. So the present studies aim to find the relationship between smartphone addiction, sleep quality, and happiness among young adults. Correlation research method was used for this purpose. A sample of 250 young adults were recruited by convenient sampling technique, and permissions were gathered, and the process of the research was followed according to the protocol. So smartphone addiction is something that is rapidly advancing in science and technology and has led us into getting many new inventions and gadgets. So smartphone is one of the inventions that technology has given to us, and this invention is being used by all people, means of all ages, genders. So most of the people spend their time on social medias, emails, business, and stuff like that, and about 95% of people in America on their own cell phone, while 77% possess their own smartphones. So across the world, about 1.85 billion people use smartphones, according to the research conducted into 2014. Okay, so sleep quality is another thing. Poor sleep quality is a symptom of not being able to fall asleep, and extensive research has shown that sleep quality has become an increasingly public health focus. And poor sleep quality leads to the risk of mental problems, lower levels of subjective well-being or happiness. Now, what is happiness? Happiness has been defined as a combination of feeling good and functioning well, the experience of positive emotions such as contentment, as well as the development of one's potential, having some control over one's life. And how do we have a sense of purpose, and what are the positive experiences or positive relationships that we have around us? So according to the literature review, there were researches that were conducted in this regard, like smartphone addiction, poor sleep quality, self-regulation, and bedtime procrastination in China upon undergraduate students, and the results reflected that there was a non-significant effects of smartphone addiction via self-regulation and bedtime procrastination on 3 indicators of poor sleep quality was statistically significant. Okay, so the rest of the literature review also supports this topic that work has been done, but the indigenous work is missing, means the work that we need in our culture is missing. So happiness, the rationale of my study was that happiness is an element which is much needed to carry a good mental state, and there may be factors that may affect it. The biopsychosocial model suggests that happiness and overall well-being of a person may be affected by sleep quality he takes. Nowadays, sleep quality is not as good as it was before, so many people of all age groups are indulgent using smartphones to pass their time, like using social media or other applications. This trend of sleeping late has mostly been seen in young adults. In the current study, the main aim is to find the connection between smartphone addiction and sleep quality regarding the overall happiness of an individual. And this will provide an empirical support and add into the indigenous data as well. So the objective of my research was to find the relationship between smartphone addiction, sleep quality, and happiness among young adults, along with the measurement of likelihood of smartphone addiction and sleep quality in predicting happiness among young adults. So the hypothesis that was formed was that there is likely to be a relationship among smartphone addiction, sleep quality, and happiness in young adults. And smartphone addiction and sleep quality are likely to predict the predictors of happiness in young adults. For the method, I used correlational research design, and the participants were recruited through convenient sampling, ages of 19 to 25 years, and the sample size was 250. So this is the demographic table showing the basic demographics and how were they being, what was the basic demographic ratio among the data that we collected. It included age, gender, birth order, number of siblings, education, possession of a smartphone, and access of it all the time, along with what do you specifically use on your phone, and when you sleep at night or hours of sleep you get. So the inclusion criteria was that it included the participants from universities of Lahore, along with the individuals who use social media account and own their own smartphone, while the exclusion criteria was that the students outside of Lahore, means who weren't enrolled in a University of Lahore, were excluded, along with the students who have other health or psychiatric issues, and married students were excluded as well. So smartphone addiction is basically the excessive use of smartphones in a way that is difficult to control, and its influence extends to other areas of life in a negative way. Sleep quality is defined as one's satisfaction of the sleep experience, integrating aspects of sleep initiation, sleep maintenance, sleep quality, quantity, and refreshment upon awakening. And happiness is an emotional state that is characterized by the feeling of joy, satisfaction, contentment, and fulfillment. While happiness has many different definitions, it is often described as involving positive emotion and life satisfaction. So the measures included a demographic sheet, smartphone addiction scale short version, sleep quality scale, Oxford happiness questionnaire. And the procedure was that permissions were taken from the university, from the two authors, and a pilot study was conducted initially. Then the collected data the data collection was completed within 1 month. And a written consent was signed by the participants for filling the questionnaires, and all the ethical consideration given by APA were strictly followed. Like a brief discussion, a description of the research was delivered to the participants, and the participants were informed about the administration, the confidentiality and privacy issues. In statistical analysis, reliability analysis were run to find the psychometric properties of the questionnaire. Person product moment correlation coefficient was run, and multiple hierarchical regression analysis was done as well. So the reliability of our scales fell into the point where it was okay, means the reliability of the scales was good. And in correlation, it was found that there was a relationship of smartphone addiction, sleep quality, and happiness among young adults. And it was also just suggested that there was a significant positive relationship of sleep quality with happiness, and there's a negative relationship of smartphone addiction with happiness, implying that individuals who have good sleep quality are more likely to have happiness in their life, whereas the people who had smartphone addiction showed lower levels of happiness. So in the multiple hierarchical regression, it was found out that there was happiness and sleep were significant predictors of happiness. So in the discussion, we saw that there was evidence present that suggested our results were according to the past literature. Limitation and suggestions regarding my study was that the data was taken from young adults only, while smartphone is being used by people of all ages. Equal number of young adults could have been taken for future study, means the equal number of gender, male and female, and more studies could be taken of the country to get a better generalizability of the results. So the conclusion suggests that young adults who have better sleep quality are happier in their life as compared to those who are not having proper sleeping hours. Smartphone addiction was found to be a reason of having a life where they were not as happy as people who did not overuse their phone. And the future implication of the study was that this study is very helpful for shedding light upon the addiction that is not being acknowledged by many, which is the smartphone addiction. By the means of this study, we can plan a better management plan for the professionals so that awareness can be brought about how a smartphone addiction is affecting the youth, along with sleep quality and how is it being affected by the smartphone addiction as well. And after that, we can work upon how these elements are working upon the subjective happiness of a person. We can improve the level of happiness in the youth by means of this research, and light can be shed upon the lifestyle choices that are crucial for the overall mental and physical health. And that will be all from my side. Thank you very much.
Thank you, ma'am, for enlightening us. Ma'am, there is a question for you.
Yes.
What was the instrument used to measure happiness? Can you please answer?
Yeah, it was the Oxford Happiness Questionnaire. So it's a self-report tool to measure happiness. It consisted of about 29 items and had a 6-point Likert scale, from strongly agree to strongly disagree. And the reliability of the scale was 0.78. And it was used to measure the level of happiness in the individuals, because in the past literature that I viewed, the scale was used for finding the levels of happiness as well.
Okay, thank you so much, ma'am. Now I request the chairperson, Professor Dr. Humaira Fayaz Khan, to conclude the session. Please, ma'am.
Thank you, Dr. Sana. Assalamu alaikum, everyone. It was a delightful session, I must say. I must say that everyone presented very well. The researches were very good, innovative, though it was a varied collection of researches, but I still found that it was very pertinent to today's talk, which was about lifestyle medicine and food. I hope everyone enjoyed this session. And at this point, I would like to say we are going to have, I want to thank everyone. And for till 2 o'clock, we are concluding or we are having a break, a lunch break and a namaz break. And we'll join back at 2 o'clock at rather 1:55. Thank you, everyone.